Assalamu alaikum everyone, welcome back to my channel. This is Dr. Hajira and today I am going to talk about endometriosis. 176 million women worldwide have endometriosis. This is 1 in 10 during the reproductive years, which are typically from when the period starts until menopause. Symptoms can include pain before and during periods, at ovulation, when going to the toilet, and chronic pelvic pain, as well as fatigue, painful sex, and difficulty getting pregnant. Many people don't realize these symptoms of endometriosis. This lack of awareness frequently causes delay in getting treatment. If you have or suspect to have endometriosis, this video will help you understand what the disease is, how it is diagnosed, options for treatment, and where you can find support. Endometriosis occurs when so similar to endometrium, which is the lining of the uterus, or found outside of the uterus. These misplaced cells known as lesions grow and bleed each month in response to hormonal changes, just like the endometrium does during normal menstrual cycle. This results in inflammation, causing scar tissue and adhesion, which abandon fibrous tissue. It sticks organs together. Endometriosis lesions are most common inside of ovaries, that also known as chocolate cysts, on the fallopian tubes, on or behind the lower parts of the uterus. On the uterus sacral ligaments, which are abundance of tissue holding the uterus in the place, on the bowel and bladder, and on the lining of the pelvis called the peritoneum. In rare cases, endometriosis can be found outside of the pelvic cavity. Why some women develop endometriosis and others don't? It is likely certain genes may predispose some women to develop a disease. Endometriosis is not contagious and it is not sexually transmitted. Diagnosis. Diagnosing endometriosis can be difficult because it is often mistaken of other conditions. Similar symptoms, a combination of a pelvic examination and list of symptoms can help you to diagnose endometriosis. Talk clearly about your symptoms, how often you have them, and how about they are. A diagnosis may also require an ultrasound or an MRI scan, but if this equipment will not likely show smaller endometrial lesions. A conclusive diagnosis may require laparoscopy. This is a minor surgical procedure where a small incisions are made in the abdomen to insert a laparoscope, a long tube instrument with a light at the end that allows a surgeon to see endometriotic lesions. There is no known cure for endometriosis, but there are treatments which can help relieve your symptoms and improve your quality of life. The trick is to find the right solution for you. This means talking with your doctor about symptoms, how they affect your daily life, and discuss with you when to have children, now or in the future. Let's take a look at the treatments currently available. Surgery is the most invasive treatment, but it offers opportunity for endometriotic lesion to be cut out at the same time the diagnostic laparoscopy. The success of the surgery would depend on surgeon. Find a specialist with experience in laparoscopic excisions. Hormonal therapy is used to suppress the menstrual period to prepare the monthly bleeding. There are several types of the medications that act by shrinking the lining of the uterus and the endometriotic lesions. The oral contraceptive pill is often used to surface treatment, especially in younger women. You can take the pill as you would for contraception, or you can take continuously for 3 or more months at the time. Gonadotropin releasing hormone and analogs, also known as a GnRH analogs, can be injected monthly or taken daily by nasal spray. This treatment typically prescribed for up to 6 months and creates temporary medical menopause. Progesterones are sympathetic hormone similar to the naturally occurring progesterone. They are available in the form of daily tablets, weekly or monthly injections, and an intrauterine device. You may need to try more than one type of treatment before you find the one that works best for you and has the least side effects. Over-the-counter prescription painkillers. How? By blocking receptors on the nerve ending around the lesions. If you use painkillers, make sure to take only the right recommended amount under close monitoring by your doctor. Taking more can risk gastrointestinal problems and painkiller addiction. Endometriosis affects 1 in 10 women during prime of life. You can't fight endometriosis. Don't accept pain as normal. If you cannot go to school or your work or struggled to carry day-to-day activities, talk frankly with your doctor about your symptoms and ask for a referral to a specialist of endometriosis. Accept that your treatment may change or have to be adjusted depending how you respond to it. Look after yourself mentally and physically. Eat well, get regular exercises, and get enough rest. Thank you so much for watching this video. Subscribe to my channel and stay tuned for the next video.